Okay, welcome back. And so now I have my notes and with the statistics and the warning signs and all the other useful information in regards to this. So, how do mental health conditions affect the African American community? According to the Health and Human Services Office of Minority Health, African Americans are 20% more likely to experience serious mental health problems than the general population. Common mental health disorders among African Americans include major depression, attention deficit hyperactivity disorder, ADHD, suicide. I had my struggles with that, as well as major depression, and post-traumatic stress disorder, because African Americans are more likely to be victims of violent crimes. And we discussed that earlier about the PTSD, being in certain communities and, living in a racist society, that how PTSD really affects us more than we think that it doesn't. It's not just something that's, that affects military veterans or anything like that. And a lot of times we really believe that PTSD is just something that military vets face. With, there's a war on black people. So, you don't have to go overseas. You don't have to, somebody who served in, the war on drugs, Desert Storm, or, in Afghanistan, and, all of those things that we think that, only soldiers are affected by PTSD. No, 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 no. The everyday average black man and black woman, we suffer PTSD because there's a war, on us and our bodies and our lives. So yes, we are affected by PTSD. So African Americans are also more likely to experience certain factors that increases our risk for developing mental health conditions: homelessness, exposure to violence. And there's some issues that we have to consider. There's different reasons that prevent African Americans from seeking the treatment and receiving the quality care that we should, which is the lack of information and the misunderstanding about mental health, which I said a lot of people don't think that they're connected to it, and a lot of people don't think that they are affected by it. And our faith and our spirituality and community. So a lot of times our religion, and we think we just need to turn it over to Jesus. I mentioned that, and Jesus has to take the wheel, and, we'll just, pray the demons away, and, those kind of things. And like I said, I hate to, sound all anti-religious and stuff like that. But, religion does, stop us from seeking the treatment that we really need to seek, because a lot of times, these, prayer circles and the prayer warriors, it's not saying that they don't help, because of course that they do help, but they have to work alongside mental health professionals as well. And there's also a reluctance and an inability to access mental health services. Only about 1/4 of African Americans actually seek mental health care, compared to the 40% of whites. And there's reasons why. The distrust and the misdiagnosis. Because historically, African Americans have been and continue to be negatively affected by the prejudice and the discrimination in the healthcare system. Misdiagnosis, inadequate treatment, and the lack of cultural competence of the healthcare professionals. And that causes the distrust and prevents African Americans from seeking and also staying in the treatment. Socioeconomic factors that also plays a part, because according to the U.S. Census Bureau, and this, stat is, a little bit outdated because it's from the 2012 Census Bureau, and we're now in 2019. But only 19% of African Americans you know, had no form of health insurance, and that's a lot. 19% of African Americans had no form. So who knows? I'm not familiar with what the stats are currently of uninsured African Americans, but that plays a huge role in whether or not we actually seek treatment and get to treatment, because a lot of us can't afford to pay that out of pocket expense for therapy and, psychiatry and things like that. So if we don't have the healthcare coverage, yeah, then that's going to reduce our chances of actually, getting the treatment. Then there's also the provider bias and the inequality, of care. So African Americans, especially women, are more likely to experience and mention, physical symptoms related to mental health problems. And we all know that with African American women and their health care, when we start talking about having physical aches and pains, whether it be with childbirth or anything in general, they're less likely to believe us. So we often get misdiagnosed when we're talking about certain aches and pains that are related to emotional and mental health, because that comes along with it. We get misdiagnosed. So the physical symptoms that's related to mental health problems, for example, you may describe bodily aches and pains, when talking about depression. A healthcare provider who is not culturally competent might not recognize that these symptoms are symptoms of mental health conditions. Additionally, men are more likely to receive a misdiagnosis of schizophrenia when expressing symptoms related to mood disorders or PTSD. So I also mentioned earlier about seeking healthcare providers that, have a cultural consciousness, because our symptoms show up differently. So if you have a healthcare provider who's not familiar with treating African American patients, then that'll increase the chances of you being misdiagnosed. So don't be afraid to ask these questions that you need to ask when you're doing your research and when you're looking for a provider to provide you with the level of care that you really need to have. Don't be afraid. Ask the questions that you need to have. So finding the right provider for you. Like I said, unfortunately, the research has shown that the lack of cultural competence in the mental health care, and that results in the misdiagnosis and the inadequate treatment. But you can improve your odds of getting culturally sensitive care by asking the following questions. Have you treated other African Americans? We mentioned that already. Have you received the training in cultural competence or on African American mental health? How do you see our cultural backgrounds influencing our communication and the treatment? Let's hear this again. How do you see our cultural backgrounds influencing our communication? That's the communication between you and the healthcare provider, and the treatment. So that has to be, that's important. So the cultural background between you and the healthcare provider, you have to have that line of communication and be able to have that open level of communication. And how do you plan on integrating my beliefs and practices in my treatment? So yes, the cultural, like I said, alongside, your mental health treatment, if you have, your cultural practices and your spiritual practices, if that needs to be part of your healthcare, yes, they need to also be able to incorporate that and, discuss how all of those things can work hand in hand. It's not one over the other. It's not one instead of the other. They both have to work hand in hand. Okay, so now we're going to also get into the differences and the specific differences between black men and black women that we need to recognize, because it's not a one size fit all for the black community, and men have their needs and women, we have our needs, and we have to recognize that there are differences between us, and we have to be aware, of that, and, to be our brothers and our sisters keeper. So even if we don't think it affects us, it'll affect somebody in your circle, somebody you're close to, family, friend, whatever type of loved one. And as it relates to black men, the emotional stoicism of black men is something that few authors have talked about. And this is, this stuff here that I'm reading from is actually from Talkspace. So, some of this is not only my research, and these are coming from, other sources. Okay. So, in Bell Hook's work, We Real Cool, Black Men and Masculinity, and put that on your reading list, discusses the lack of love and acceptance that black men face, creating an emotional crisis. Many men have not been told how to process and talk about their emotional experiences, furthering a sense of isolation, anger, and resentment. And for these men, it creates an emotional volatility that sometimes manifests in, seeming, they shut down. And we all know this when we're dealing with the men in our lives, that a lot of times that they're just so emotionally distant and they shut down and they don't want to talk. And I deal with this with all the men, the friends, and, the men, the closest men in my life. They just shut down and they're not always emotionally honest. I'm good. That's their default, as I'm straight, and they give all of these real blanket generic, and that they're not good, and that they're not straight. And the thing about it is, we know that there's that level of pressure and that level of stress of being men and being able to be the provider, and then being in a culture where our women are making more than they're making, and they feel emasculated, and they feel like, they're being gunned down by, the police officers, and all of these things that, are taking into place, and they feel the court system, when they're fighting for their children and everything is against them. This is affecting our brothers' emotional health, and we have to give a damn about what is taking place with our black men. And yes, of course, as a black woman, there's stuff that's going on with me, and there's stuff that's going on with black women. But there is no room for, oh, well, I'm a victim too, so I can't be concerned about you. No, we have to step up for each other. We lean on each other, and it's like, I got you, you got me. We have to have each other, because unless we have each other's back, we will not survive out here in these streets. And you know that. We all know that. So we need to stop having these wars with each other, these gender wars, because we need to be available for each other so that we can heal, and that so we can sit up there and fight the war against them, because they're warring against us. So we don't have no time to be warring with each other. We don't, no. No time for that. We got to get ourselves together, so that this way we can be strong for each other so that we can fight them. We don't have time to fight each other. We don't have that luxury. No. No. So anyway, so back to the, the notes. So many men, they struggle with being vulnerable, and we know that. They're not trying to share their emotions. They're not conditioned to think that their emotions have any value. So they're just conditioned to believe that their ability to provide, their ability to protect, those are the things that as men that they're conditioned to believe, because that's what, the masculine energy is all about: protection, providing, having, the spiritual leadership. That's what we believe that, their role is: emotional, health, and they're not praised for any level of that. That's viewed as, something feminine, being in tune with your emotions and, that kind of stuff. That's all viewed as feminine stuff. But of course, within each spiritual being, you have your masculine energy and you have your feminine energy. So every man, every woman has both. So you have to be able to master both your masculine and your feminine energy. But we're conditioned to believe that, okay, well, emotional and being in touch with your feelings and being vulnerable, that's all women stuff. So men don't see any value in developing that skill or having, high levels of emotional intelligence. And you're taught and you're socialized to believe that those things, if you're too much in touch with your feminine side, that, you need to correct that and you need to man up all the time. And we're telling, man up, man up, man up. Big boys don't cry. Be a big boy. You know what I mean? No. We're not doing that anymore. In 2019, in the age of authenticity, we are going to connect to all those parts of us that exist. We're not going to deny those parts of ourselves that need to be addressed and that needs to be healed. So yes, men have emotions and we need to take care of our men's emotional health. And men, you need to see the importance of being in touch with your, what they call the feminine side or your emotional side. And yes, we're going to work with you on that because we care and because we love you and we're here for you. So yes, we're going to work with you on that. And we know it's difficult because you're not used to being vulnerable and you're not used to expressing those parts of yourself. But we're going to work because we are, as women, we're committed to you. And we're committed to your emotional and your mental health. So we're walking with you on this. And we're going to walk through your darkness with you. Because as women, we're your light. And we, as women, we have to understand that this is what our roles are. Our roles are as healers. And we are the light. And we have to walk with our men through their darkness. And that's what we're going to do. In 2019, this is what we're doing. We're not leaving them out there to walk through their darkness by themselves. No. That's not what we're doing in 2019. No, we're not. Okay, so now, there's been recently more celebrities that's coming out, discussing their mental health. King Cudi has discussed, his mental health. And I'm seeing here, in my notes and research, there was a hashtag that, that I wasn't even aware of that existed, hashtag you good man. And so I gotta look that up. That and I seen also recently, there's Mental Health Mondays, but there's a hashtag, you good man, that's trying to really get our brothers to open up about their mental health. And we need to start taking note of that. We've all seen what Kanye West, and he's been more open and honest about his condition, and dealing with bipolar disorder, and yeah. So then there's also the barriers that, to us, seeking help. It's a real circular problem, when it comes to our men, and getting the help that they need, because to get the help that they need, men they have to first open up, and they have to admit that they need help, and go to someone and ask for the help. But in order to open up and admit that they need help, they have to break down that cool, I'm good facade. And and so it's like it just goes around and round in a circle, and trying to just put themselves in that vulnerable position. And we talk about that a lot on SoulShare. Just about every other episode, we're talking about the ability to be vulnerable, and how difficult that really is to allow ourselves to be vulnerable, because we feel that fear of judgment, and we have to release that fear and find the courage, and understand that there is beauty in being vulnerable, and find that courage to ask your brother, ask your sister, for help. It's okay. We got you. And we have to, let go our anger, and see that, the anger, that is one of the symptoms of the depression and emotional issues. And just say, we're gonna get through this together, and we're gonna walk this walk and this journey together, and we gotta get past it. So it's, stop fighting with your baby mother and your baby father and your spouses and everybody else, and your friends that are in your lives and on the internet. You know what I mean? We gotta stop fighting with each other, and we gotta come together, and we gotta say, yo, I got you, and take care of each other, because our numbers is way too high for us to even, to not take this stuff as seriously as we should be taking this stuff. You know what I mean? So we got to get on it. We got to get on it. And, we understand that, there's that distrust, with the in our community, with the healthcare providers and stuff like that. We got to move past that, you know what I mean, and still get, the help that we, to get the help that we need. So, there are the top 8 signs for Black men in depression: sleeping too much and too little. So like when you see, they're sleeping like 10 hours, 11, 12 hours a day, and they're just so tired, and they're always fatigued, that's a symptom of depression. And that's like one of the more common ones that we always, are able to recognize. But if you're sleeping too little, that's, they're getting up every couple of hours and stuff like that, that's a symptom of anxiety, when your mind is, racing so much that you can't even go to sleep. And I've struggled with that personally, where it's just like I wasn't sleeping, and battled with insomnia, because it's just like my mind was doing a million things, and I couldn't turn it off. When you feel that you can't turn your brain off, that's anxiety, babe. Yeah, that's anxiety. And I didn't immediately recognize that's what it was. We just think, oh, we're just stressed out. You know what I mean? No. We just call everything stress. It's depression. It's anxiety. And not that stress is an inaccurate word. It's very accurate, but it's indicative that there are mental and emotional health concerns. So if you are starting to realize that you have these high levels of stress that never seem to go away, it's depression, and it's an anxiety. And you need to start paying attention. It's not just stress. And we shouldn't be diminishing what we feeling and feel like, oh well, this is just par for the course. No, 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 no. We're not doing that. We're not being dismissive of ourselves, and we have to be more diligent when it comes to our self-care. And we have to take care of ourselves, our minds, and our bodies, and we have to do better with that. Black people, we have to do better. Okay? And this is what we're doing now. We're working on that. Okay? And another symptom is pain. And men don't realize that there's chronic pain and digestive disorders that go hand in hand with depression. So there's health problems such as constipation, diarrhea, headaches and back pain. All of this is symptoms of depression. And we need to start paying attention to our physical changes in our bodies, so that we can be aware of all the stuff that are taking place. So another sign is the loss of focus. So our psychomotor retardation can slow down a man's ability to process information, thereby impairing his concentration and his ability to perform certain tasks. So pay attention to all of those things as well. Anger, and the whole angry black man syndrome, and even the angry black woman syndrome. So that's also part of it as well, and that's also a sign. Some men, it manifests being hostile, angry, aggressive, and anger and hostility are different than irritability. Anger tends to be the stronger emotion, and irritability is, just, a little bit of crankiness. So, you can just, if he's a little cranky, it may not necessarily be anger, but, we just pay attention, because we know the angry brothers, and, the difference between and the one that are just a little bit, miserable, so we know the difference, some that just miserable and some that's just angry. So, the difference, so, yeah, so that's, also something that you got to pay attention to. And stress, like I said, sometimes we just, say that we stress, but it's also a symptom of depression. When we're saying, when you're hearing somebody say that they're stressed, they stress, pay attention to that. All that saying that you stress out, pay attention to those friends and check in on those friends too, because that's also a sign of depression, because those things go hand in hand, being stressed and depressed. We mentioned this before, the substance abuse. You see me here drinking the wine. I don't make any excuses. I'm not perfect. I'm learning just as much as, anybody else, and I understand the importance, and I need to do better, with a lot of things, and I'm going through this with you guys as well. So I'm walking this walk with you. I don't profess to be a perfect teacher or anything, like that. No, I have a lot of help that, that I need. So, yeah, so there's the substance abuse, and that frequently accompanies depression. So whether it's the alcohol, whether it's the weed smoking, or even the harder stuff and the harder drugs. And it can happen for both men, and it can happen for women as well. And then then there's also the sexual dysfunction. Depression is common reason for the loss of this sexual desire and erectile dysfunction. And it's one of the symptoms that men won't report. They're depressed, and they ain't able to get it up. You know what I mean? If they're depressed and they're stressed and things like that, you know what I mean? So they're not able to get it up. Their mind is elsewhere, to maintain an erection. And we all know that sex, the majority of it is mental. And if you're distracted, you're not going to be able to perform. You know what I mean? So a lot of times, you're thinking that these men, they need Viagra, they need this. No, it could just be that they're just distracted. You don't need Viagra. You need to address your mental and your emotional concerns, and then you won't have to, pop a pill for erectile dysfunction. You know what I mean? And because you're not addressing what the illness is, and you're just dealing with the symptoms. So we got to deal with the core, which is the mental and the emotional health. And then of course there's the suicidal thought. So that's a little bit more obvious. What women are more likely to attempt suicide. Like I said, I did when I attempted suicide when I was 16 years old. you know, since we're talking and, we're being honest, here. And, but men are more than 4 times as likely to die if they do attempt suicide, because clearly I'm still here, so, and one of the reasons is that men tend to choose more lethal methods, where I guess they're using the guns to the head and that type of stuff, where us women, we tend to we like the less messy options, so we think about what people, when they find the body and the cleanup, and so we tend to do less messier options. If I'm gonna be honest, what I did, I took pills. It was diphenhydramine, and I downed it with some vodka at 16 years old. So that was what I did. And what happened was, when all the stuff started to kick in, I called 911 myself, and the ambulance came, because I really didn't want to die. It was more about a cry for help at that time. And I called 911, and they came and got me, and they gave me that charcoal drink, and to bring it all up and stuff. But yeah, that's what that was, for me when I did it. But for for women, let's move on to the women now. With the a lot of anxiety exists, with black women. And like I said,